Hello, I am Dr. Anand Marthanda Pillai, consultant interventional cardiologist and electrophysiologist at Ananthapuri Hospitals and Research Institute, Trivandrum, Kerala. Hypertension or high blood pressure is a very common cardiac condition leading to life-threatening complications such as stroke and heart attack. Today, let's look at what is hypertension or high blood pressure, what is normal blood pressure, when is it high, how do you detect the blood pressure and how is it treated? We know that heart is a muscular pump which pumps blood to the entire body. And when the heart pumps, it generates a pressure which is measured usually in the arm, and that is what is blood pressure. Normal blood pressure is around 120 over 80. The higher number is systolic blood pressure, and the lower number is diastolic blood pressure. Somebody is said to have high blood pressure when the BP is more than 140 over 90. It is also important to note that there can be a day-to-day variation in blood pressure, particularly when somebody is walking fast or exercising, or even at rest when you are anxious or stressed out. Your blood pressure can go up to 150 or 160, which is normal. Which is why it is very important to measure the blood pressure when you are resting and relaxed. Why is high blood pressure so important? It is because uncontrolled high blood pressure can lead to very life-threatening complications. The most important of which is somebody having a long-standing high blood pressure and occasionally their blood pressure is shooting above 200 over 100. This can lead to bleeding into the brain, which is called as a hemorrhagic stroke. A hemorrhagic stroke is dangerous and can be life-threatening and often can leave somebody paralyzed, half of their body paralyzed and bedridden for the rest of their lives. Apart from hemorrhagic stroke, high blood pressure can also lead to blockage of arteries in the brain, and that is what is an ischemic stroke, and that can also cause paralysis and leave somebody bedridden for the rest of their lives. This is one of the most important messages that I would like to convey, because we come across a lot of youngsters with undetected blood pressure who come in with bleeding into the brain, which can be life-threatening or at the least it can leave them paralyzed. Apart from stroke, high blood pressure can affect several other organs in our body. It can affect the heart and cause heart failure and heart attack. It can affect the kidneys and cause kidney failure. A good number of patients on dialysis are because they have had undetected blood pressure for a long time when they were in the youth. What are the symptoms of high blood pressure? This is very key because high blood pressure can be what we call as a silent killer. Because only mild to moderate elevation of blood pressure may not cause a lot of symptoms, and only when the blood pressure is very high, above 180 or 200, that often people will experience symptoms. And the most common symptoms being dizziness, headache, and sometimes they can feel breathing trouble, chest pain, and fatigue, and so on. When should high blood pressure be treated? As we said, 140 over 90, blood pressure going above that is what is called as hypertension, and your blood pressure should remain less than 140/90 and preferably less than 130 over 80. If your blood pressure is more than 140/90, let's say around 150 or 100, that is when you need to be treated. And it doesn't mean that you need to take medications right away. Best treatment for a mild degree of high blood pressure is exercise and diet. And exercise is probably the best initial pill that you can take to keep your blood pressure under control. 20 minutes of moderate exercise for 5 times a day is probably all that you need to keep your blood pressure under check. Another common question which patients ask is, would they have to take medications for the rest of their lives? How long do they have to take the medication and so forth? The answer to that is, those who have mild degree of high blood pressure and are also obese, diabetic, have sedentary lifestyle, they might be able to control their blood pressure just with diet and exercise or maybe one medication. And if they reach the goal in terms of reducing their weight and exercise, they may be able to stop the medication altogether after the blood pressure is under control. That is only for this category of patients. But most patients have very high blood pressure right from the beginning. blood pressure such as 180 over 100, those patients would need to be started on medications right away because they can end up in trouble such as stroke and heart attack. These are patients who usually have a hereditary cause or genetically predisposed to having high blood pressure. They already have kidney failure and so forth. And blood pressure in such patients can be very difficult to control. And they might need to take not just 1, 2, there are patients who are on 3 or 4 medications, and most of them have to continue the medications for the rest of their lives. Another important concept to understand is what is called as white coat hypertension. Particularly young people, type A personality who are stressed out and anxious, whenever they come to the hospital or clinic, their blood pressure is very high. But when they get home, their blood pressure is normal. This is called white coat hypertension, as in their blood pressure shoots up anytime they are sitting next to a doctor wearing a white coat. The best way to detect this is to check your blood pressure at home, or you can use what is called as an ambulatory blood pressure, which is a cuff connected to you for 24 hours. It will continuously record the blood pressure, and the reports will reveal that your blood pressure is otherwise normal during the daytime. It's important to identify this because these people do not need any medications and they actually do not have high blood pressure. Another common concept is salt restriction to control your blood pressure, which is true. But usually it is the excess salt consumption, like taking too much of salted food or pickles, which will actually increase your blood pressure. And you have to restrict such high salt consumption to maintain your blood pressure. Otherwise, salt reduction in itself does not cause a lot of blood pressure reduction, and at the same time, excessively reducing the salt intake to the extent of your food not being tasty is not worthwhile, because the reduction you get is only slight, and excessive salt reduction can lead to low sodium in the body, which can be troublesome otherwise also. So what advices do I have for a person with high blood pressure? If you are somebody who needs to continue taking medications for the rest of your life, make sure you go for routine follow-up and ensure that your blood pressure is controlled. One easy thing that you can do is actually to buy an electronic blood pressure monitor, which is available in the market today. Keep it at home, check your blood pressure once in a while, make sure it is less than 140 over 90. Keep that in a small diary, or you can even put it on phone apps these days. When you go to see your doctor, you can review the numbers with your doctor and make sure your blood pressure is under good control. So to sum up, we talked about what hypertension or high blood pressure is, what is normal and what is abnormal blood pressure. Uncontrolled, undetected blood pressure can lead to life-threatening stroke and heart attack. If you are obese and diabetic and lack of exercise, just diet and exercise might be adequate to control your blood pressure, but your blood pressure is very high and you have a hereditary reason for having high blood pressure, you might have to continue taking medications, and you make sure your blood pressure is under control, and the best way is to have a home blood pressure monitor to keep an eye on your blood pressure. Thank you.